Welcome back to the Microlearning Credential on Effective Healthcare Waste Management. This is the second lesson of Module 4. In this lesson, we will understand how healthcare waste is segregated in a health facility. Uma continues to train Safia on waste management practices. After discussing waste minimization strategies, she starts to train Safia in the methods of segregation of healthcare waste for easier collection, treatment, and disposal. Safe management of healthcare waste is important for alignment with national regulations and well-being of people. Proper segregation, on-site storage and well-endowed transportation systems provide a continuous sequence of safe management at each step in the process. Most importantly, everything in waste management starts from segregation. Therefore, the initial focus should be made at efficient waste segregation practices. Correct segregation is the responsibility of the person who produces each waste stream, which means segregation should take place in a medical area, at the bedside, in an operating room, etc. The healthcare facility management is responsible for making sure there is a suitable segregation, storage and transport system for the waste, and that all staff abide by correct procedures. The simplest waste segregation system is to differentiate between hazardous and non-hazardous general waste. The collection and segregation of healthcare waste involves using different types of containers at various sources of healthcare waste generation, like operating room, laboratory, wards, nursing stations, kitchen, corridor, etc. The bins are placed in a way that full collection is achieved. On the screen, you can see the waste segregation guidelines developed by the Government of Kenya. As you can see, for general waste the bin is black in color. Yellow and red colored bin for infectious and pathological wastes, respectively. A puncture-proof yellow bin for sharp waste. Similarly, every country has their own segregation guidelines and rules for biomedical waste. Once the collection and segregation are done, the waste should be stored in a proper place. The duration of storage should not exceed beyond 8 to 10 hours in big hospitals, more than 250 bedded, and 24 hours in health centers. Each container should be clearly labeled to show the ward or room where it is kept. The reason for this labeling is to trace the waste back to its source, when needed. There are some general principles of good healthcare waste management practices that can help guide a health facility towards effective waste collection, treatment, and disposal. They are: healthcare waste should be segregated into different components, based on their potential hazard and disposal route by the person who produces the waste. Separate containers should be available in each clinical area for each type of waste. Waste containers when filled should be labeled, to help workers and managers identify the category of waste. Hazardous and non-hazardous wastes should not be mixed during collection, transport, or storage. Non-hazardous waste is usually handled like domestic waste during collection, transport, and disposal phases. Hazardous waste is kept in special containers and transported in puncture and corrosion-proof packaging to avoid any kind of injury and leakage. Collected waste shall be taken to central storage sites before on-site or off-site treatment and disposal. Central sites provide the functionality to segregate and treat waste with a much larger capacity. By bringing waste first to central site reassures those hazardous substances are not mixed with general waste materials, and if some kind of mixing occurs, it can be resolved swiftly. And, lastly, staff should understand the risks and safety procedures for the wastes they are handling. This can be done through training modules, workshops, and use of labeled and color-coded packaging for waste collection. Safia and Uma end the discussion, and decide to meet again the next day to study healthcare wastes treatment and disposal mechanisms.